On today's show, we look at the coronavirus pandemic and the respiratory and neurological complications arising from infection with the SARS Cov-2 virus. After 2 long years of learning to live with the virus, how much do we really know about the complications and sequelae of this novel coronavirus? This is EUFOREA News, broadcasting from London. Well, obviously, the one thing we do know is the loss of taste and smell is related to the destruction of the olfactory neurons. Now, you talk about those other manifestations neurologically. So perhaps you could outline and explain for us what exactly is neuro-COVID?
Well, we talked, basically the definition of neuro-COVID is when a person with a confirmed COVID infection is also presenting neurological symptoms. Symptoms that can be derived, that can be brought back to an affection of the nervous system.
We know that COVID-19 affects the upper and lower respiratory tract. We know the lungs are the organ most affected. We know the virus binds to the ACE2 receptor on the alveolar cells of the lungs. Tell us more about COVID affecting the respiratory tract.
The respiratory system gets affected in COVID-19, as you said, because it's an airborne infection. It's an aerosol-generated infection. So the virus travels down to the lung and causes what's called COVID pneumonia. These are patches within the lung, which result in patches of pneumonia. And there's a problem in exchange of oxygen and carbon dioxide within the lung.